This is a video on the tibial tug test during ACL reconstruction. The purpose of ACL reconstruction is to recreate stability in the knee after ligamentous injury. However, there is no reliable intraoperative test to assess the ACL graft fixation and tension of the graft after tibial fixation. The tibial tug test is an empirical test created to evaluate tibial graft fixation. Tension is applied by hand to the sutures on the tibial end of the graft. A positive test is when the graft moves while the tibial plateau does not. This indicates lack or inadequate fixation. A negative test is if the fixation is successful, the tibial plateau and the graft will move as one unit when pulling on the tibial side of the graft. Here's an example of a positive tibial tug test. I'm pulling on the tibial graft and you can see the plateau does not move, however, the graft does move. That means there's inadequate fixation. This is a negative test where I am pulling on the graft and you see the tibia and the graft move as one unit. That's a negative test.